Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Research finds consuming fruit and oats increases type 1 diabetes risk, but berries offer protection. New research presented at annual meeting of the European Association for the Study of Diabetes in Madrid, Spain, has found that eating fruits, oats, and rye in childhood is associated with a higher risk of developing type 1 diabetes. Eating berries, however, is linked to lower odds of developing the condition. Type 1 diabetes is an autoimmune condition in which the immune system attacks and destroys the insulin-producing islet cells in the pancreas. This prevents the body from producing enough of the hormone insulin to properly regulate blood sugar levels. Type 1 diabetes, the most common form of diabetes in children, is increasing worldwide. The number of cases worldwide is projected to double in just 20 years, from 8.4 million in 2021 to 17.4 million by 2040. The type 1 diabetes is a serious condition that requires lifelong treatment and so places a considerable burden on the patient and their families, says Professor Suvi Virtanen of the Finnish Institute of Health and Welfare, Helsinki, Finland, who led the research. It can lead to complications including eye, heart, nerve, and kidney problems and shorten life expectancy and has substantial healthcare costs. The rapid increase in type 1 diabetes in children suggests that environmental factors plays an important role in development of the disease. Identifying these factors will offer an opportunity to develop strategies to prevent it and its complications. Study finds patients receiving steroids have 2 times higher risk of diabetes. New research presented at annual meeting of the European Association for the Study of Diabetes in Madrid, Spain has found that patients who are being treated with systemic glucocorticoids are more than twice as likely to develop diabetes as those not receiving the treatment. Glucocorticoids fight inflammation and are used to treat a wide range of inflammatory and autoimmune conditions including asthma, rheumatoid arthritis, cancers, and other medical problems. While they can be very effective in decreasing inflammation, glucocorticoids have many adverse effects including increased blood sugar levels and causing diabetes. This is more likely when people use glucocorticoid tablets or injections than when used as inhalers, creams, or drops. A new study by the researchers at Diabetes Trial Units, University of Oxford's Radcliffe Department of Medicine, Oxford, UK, investigated how commonly patients being treated with glucocorticoids can develop new onset diabetes. The study found that patients receiving systemic glucocorticoids were more than twice as likely to develop diabetes as those not receiving the treatment. Are you a night owl? You may face 50% more likelihood of developing diabetes. EASD 2024. Night owls have a higher BMI, larger waist, more hidden body fat, and are almost 50% more likely to develop type 2 diabetes than those who go to bed earlier. New research presented at the annual meeting of the European Association for the Study of Diabetes in Madrid, Spain has found. Lead researcher Dr. Jeroen Welder-Welde of Leiden University Medical Center, Leiden, Netherlands says, previous studies have indicated that a late chronotype preferring to go to bed late and wake up later is associated with an unhealthy lifestyle. Late chronotypes are more likely to smoke or have an unhealthy diet, for example, and it has been suggested that this is why they are high risk of obesity and metabolic disorders including type 2 diabetes. However, we believe that lifestyle cannot fully explain the relationship between a late chronotype and metabolic disorders. In addition, while it is known that a late chronotype is associated with a high BMI, it isn't clear to what extent chronotype affects body fat distribution. To find out more, Dr. Welder-Welde and colleagues studied the association between sleep timing, type 2 diabetes, and body fat distribution in more than 5,000 individuals as a part of Netherlands Epidemiology of Obesity study, an ongoing study into the influence of body fat on the disease. ESR conference highlights ChatGPT surpassed trainee doctors in assessing complex respiratory illness in children. The chatbot ChatGPT performed better than trainee doctors in assessing complex cases of respiratory disease in areas such as cystic fibrosis, asthma, and chest infection in a study presented at European Respiratory Society Congress in Vienna, Austria. The study also showed that Google's chatbot Bard performed better than trainees in some aspect, and Microsoft's Bing chatbot performed as well as trainees. The research suggests that these large language models could be used to support trainee doctors, nurses, and general practitioners to triage patients more quickly and ease pressure on health services. The study was presented by Dr. Manjit Narayanan, a consultant in pediatric pulmonology at the Royal Hospital for Children and Young People, Edinburgh, and honorary senior clinical lecturer at the University of Edinburgh, UK. He said, Large language models like ChatGPT have come into prominence in the last year and a half with the ability to seemingly understand natural language and provide responses that can adequately stimulate a human-like conversation. These tools have several potential applications in medicine. My motivation to carry out this research was to assess how well LLMs are able to assist clinicians in real life. To investigate this, Dr. Narayanan used clinical scenarios that occur frequently in pediatric respiratory medicine. The scenarios were provided by 6 other experts in pediatric respiratory medicine and covered topics like cystic fibrosis, asthma, sleep disorders, breathing, breathlessness, and chest infections. Study finds obesity a key risk factor for COVID-19 infection. A new study by investigators from Mass General Brigham has found that obesity may be an important risk factor for infection from the virus that causes COVID-19. Researchers analyzed electronic health record data from Mass General Brigham and found that individuals with obesity were 34% more likely to become COVID positive after reported exposure than individuals without obesity. Their findings published in PNAS Nexus indicates that obesity, a well-known risk factor for more severe symptoms and complications from the virus, may also increase risk of infection. We knew that obesity raises risk for severe COVID-19 outcomes, but we were surprised to find that it could also increase the likelihood of catching the virus in the first place, said corresponding author Masanori Ikawa, MD PhD Director of Center for Interdisciplinary Cardiovascular Sciences at Brigham and Women's Hospital. This suggests that obesity may play a more significant role in COVID-19 transmission than previously thought. Our results add to the growing body of evidence that maintaining a healthy weight is crucial for overall health. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.